administering insulin to a patient in room 422. So first of all, what we're going to do is we're going to check the physician's orders to make sure. And it says, yes, he's going to be getting insulin glargine, also known as Lantus, at 2,200. He's going to be getting 18 units. It's not on a sliding scale, so I'm going to check the MAR. And that's the same thing here on the MAR, 2,200, 18 units of insulin. Here's insulin glargine, and I'm going to check against the MAR. This is the right medication. I'm going to check to see if it's expired or if it's been contaminated or tapped with or anything, and it looks to be good. So, right medication, it's going to be sub-Q, right route, right dose, right time, right patient. So now what I'm going to do is I'm going to clean the top of, wash my hands, clean the top of this thing. Okay. Syringe, because it's going to sub-Q, and it says in here sub-Q, here it says sub-Q with this. So I'm going to draw up 18 units of air. No bubbles or anything. Checking 18 units. You see it's 18 units, 18 units, and the physician's order is 18 units. I'm going to use the scoop method to tap the other way. Okay, and we've got that. We'll put this in it. Put that in there. Okay, now it's time to go into the patient's room.
All right.
Knock, knock. Thank you. Hi, I'm Jackie. I'm your nurse, and we're going to be administering. This is Robin. She's a student nurse. We're going to be administering your insulin today. I'm going to wash my hands. Can you state your name and date of birth, please?
Allison Craig, 21283.
Okay. Allison Craig, 21283, and here on the physician's orders, right patient. And I'm also going to scan as well. So, yep, came up correctly. So you're going to be getting insulin today.
Okay.
And have you had insulin before?
Mm-hmm.
Okay. This is your long-acting insulin, so you get it once a day, and we're giving it to you in the evening. Where do you usually get your insulin?
In my belly.
In your belly?
Mm-hmm.
Okay. Well, it's important to rotate the sites of the insulin to prevent lipodystrophy. So, what side have you been getting it on in your
I
belly?
usually do it on this side.
Okay. Well, we're going to do it on the other side this
Okay.
time. And so, put on gloves. Okay, so now I've got the right medication, the right route, sub-Q, the right medication, scan the medication, and I'm going to administer the medication, so I'm going to get one of these little alcohol swipey pads. Leave it in the back of your right, on the right side of your belly. Swab. Pinch. Okay, get rid of it, and we're good. So, just to tell you a little bit, do you wear a medical ID?
I don't.
No, it's important to wear one because you are diabetic, and in case you experience episodes of hypoglycemia, you know, if you pass out or anything like that, like people will be able to help you and like know what to do. So that's an important thing to do.
That's a good idea.
Do you have any questions or anything like that? Okay, great. Well, we'll be back on you in a little bit to check on you. All right, thank you.
Thank you so much for demonstrating safe medication administration. I just have a couple more questions if you don't mind.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, definitely. Well, I double-checked everything, and I made sure that his blood glucose level, which was 242, that it was high. I wouldn't have administered the medication if it was lower. And also, I made sure that it was the doctor's orders against the Mars orders and everything like that, so all the checks were good and it wasn't expired or anything.
Did this information affect your decision to administer the medication?
Yes, definitely. His A1C was also at like 6.5%, and his blood glucose was high, so it affected me to just continue to go on. I also asked him where he got his last injection site, and we wanted to make sure that we rotated the sites as well.
Did this information affect how you administered the medication?
Yes, I administered the medication subcutaneously, but I administered it in a different position. So.
Thank you so much for answering all my questions. I really feel like I understand this so much better.
Okay, great. Well, I'm just going to document and, you know, that I did the right patient and all that and all the checks and everything, and that he got it in his right abdomen.
All right, okay.